For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare and Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and I just want to share with you an article that Ed shared with me. Ed's from the studio running this program, and he sent this article from Newsday. It was published just this week. It was written an article by Dothinia Ricks saying dietary supplements rich in antioxidants may do more harm than good when it comes to cancer prevention. A Cold Spring Harbor laboratory scientist and Chicago colleague suggested in a newly published report. And two doctors, Dr. David Tuvison and Dr. Chantel of Northwestern, said in New England Journal of Medicine, which is a very prestigious medical journal, that dietary antioxidants have consistently failed to reduce the incidence of carcinoma. And there's multiple references there if you want to read it. It's this week's New England Journal, and it's also in Newsday. So if you have a cancer, you may want to get a treatment that has great chance of work, not that is some theory with no data. It's your life. Of course, you can do whatever you want. It's a free country, but you may want to spend your time and money to do things that are proven, that have a good chance of putting you into remission, not that may take your life. In the good news department, a very good friend of mine and my electrician, who I've known for 20 years, came to me last year with a parotid cancer. The parotid is a gland just by the ear. Excuse me. And in this case, he had a mass by the ear. He found it. Was proven to be cancer. We treated it with focused beam radiosurgery. He came to me this week, had a new scan. He's in complete remission. He's doing great, feeling great, fully functional, no adverse effects from treatment. So it's good news. Our friendship hopefully will continue till both of us are 120, although he's about 20 years younger than me, so I have to be about 140. And we had another new patient this week, a woman who's been suffering since April with abdominal bloating. Her abdomen is getting distended. She's been seen by multiple doctors, liver doctors and others, and they've been doing a zillion tests since April, May, June, now July. She had cramping, abdominal pain. She had abnormal blood tests. But no one ever staged her up. No one ever proved the cancer until she came to us. And on one day, we got her completely staged up, and we got a little needle going in to the most convenient place to find the cancer. This was all done Thursday. Her CA19-9, which is a cancer marker for most commonly pancreas cancer, was 44,000. So if you have a cancer, you may want to know what your cancer marker is. It helps tell you if the cancer is being treated successfully or not. Sometimes doctors don't tell patients the marker, and I think that's not right. I think that the patient is in charge of their case. The doctor works for the patient. So in one day, she had everything done. Now we know why she's having pain. We know where the cancer's coming from. We know where it's located. It's in the pancreas and liver. She can have a variety of options available to her, and most every patient does. I would propose that we treat with 5 treatments the pancreas. That should help relieve her pain. Often pancreas cancers grow into the celiac plexus, which is a group of nerves, and that causes a lot of pain. We know that patients with pancreas cancer often have depression and pain out of proportion to other cancers. So I met with her. Her daughter came in from New England. I met her son, who came in from Harlem. We all met together and spent hours together on her case. They got copies of the reports. They know where the cancer is. And now it's their decision on what to treat, and obviously, ultimately, the mother's decision, who is the patient. Today we have a lot of tumors from unusual places, and one of the most unusual is a tumor called ameloblastoma, which is a tumor from the elements of a tooth. So if you think that your tooth can betray you, well, if you've been to the dentist, I guess you know that it's true. Anyway, this man had a tumor a couple years ago the size of a marble on his mandible. The doctors in New Jersey, the surgeons, removed much of his mandible. They removed his teeth. They took bone from his rib, bone from his leg. He had months and months of recuperation for this ameloblastoma treated with surgery, and it didn't work. So he came to me. This is a man who has a mass, when he came to me, like the size of an apple, sitting just behind the skin of the chin. So you can imagine inside the mouth, behind the lip, is a mass the size of an apple, so big he couldn't close his mouth, and he'd walk around with this mass sticking out of his mouth, and it was, for people who didn't know, frightening to them. He said, "Doc, I can't eat, I can't speak," and he could barely speak, he can't eat, and he walked down the street and people were afraid of him. It was a terrible situation. So we got all the data together for him. We proposed a treatment with focused beam treatment, radiosurgery, 5 treatments. Now he's had 3 of the 5, and he came in this week after the 3rd treatment, and for the first time in years, he could close his mouth. The tumor is shrinking so fast. He could close his mouth, he could speak, and he can eat. In fact, I knew when I called him up a couple days before he came in, just to see how he's feeling, and he says, "Doc, it's me." I said, "No, this is your son. Your son always answers the phone." He says, "No, this is me. I can speak. I can finally speak after years of not being able to speak." Because part of speaking is to control the lips and to control the mouth, and he couldn't do that. The tumor was so big. And I saw him the next day. He came into my office. Wow. We took photographs of him. The staff couldn't believe how much it shrank. We redid the planning, and already after 3 treatments, the tumor shrank by nearly 50%. Wow. Wow, wow, wow. So if you don't think our treatment works, come on in and see this man. Wow. Or look at our data, or have the experience yourself. So here's a tumor from the elements of a tooth that came to betray this man. He thought he was a goner, couldn't eat, speak, couldn't have a social life. I took him up before his treatment to get a taxi, and the taxi driver ran away. He was so afraid. So, yes, we take on easy cases, but more commonly we take on tough cases that others don't successfully treat, like in this man, the amelioblastoma. So if you have a strange tumor, or a tumor that's not responding, or treatment that's not tolerated, you should give us a call. You'll speak to the doctor. The best thing is to come in for a consultation, spend an hour, spend 2 hours, go through the data, and learn about what you have. We even give you copies of reports that we get from elsewhere, so you know what's going on. We like that the patient is a full participant. The patient should be in charge of their care, and we will be your advocate. And speaking of New Jersey, here's another woman who came to us from New Jersey with a lung cancer. She was diagnosed a year ago with a lung cancer. She got a year of chemotherapy, staged her up, and the cancer was growing. It started out at 3.5 centimeters. Now it's 7 centimeters and obstructing the airway. So if cancer obstructs the airway, air can't get in and out, oxygen can't get in, and the patient's short of breath. We staged her up. We even found, despite being treated elsewhere, we found that the cancer had spread to the brain, which she and her other doctors didn't know about. We got treatment going just for the brain metastasis, and we got treatment just going for the lung primary. Both is non-invasive treatment, both focused on the cancer, and already her CEA, which is a cancer marker, she hasn't even completed therapy, but her CEA is going down, and her breathing's better, and she's walking. Now, she was on, what she told me, heavy doses of vitamins and supplements. It wasn't working. Maybe it was even feeding the cancer. But with radiosurgery, we've been able to reverse both, get her more functional, get her cancer marker down, and we hope for better shrinkage with time. Usually, radiosurgery continues to work with time. So even though we give a treatment today, it will continue shrinking tomorrow and in the months in the future, most commonly. I want to talk about a man, unusual man, who called me this week. Father called, whose son had a Gleason 10 cancer. Now, many of you have heard about BRCA genes, the gene that causes women to have bilateral breast cancer and ovarian cancer and familial. Well, BRCA can also cause prostate cancer in men. It can be a familial gene, and in this man, it was a familial gene. He is a man with about a 40-year-old with Gleason 10 cancer, BRCA positive. He had surgery because he was told by his surgeon that it's the best way to go. Well, if he came to us or if he looked at our booklet, he would have seen that for Gleason 10 cancer, and it's right in our booklet, page 6, figure 5. If he had gone to the best surgeon in America and the cancer was confined to the prostate for a Gleason 10 cancer, what's the likelihood of being successfully treated? Do you have any idea? The cancer's in the prostate. It's a Gleason 10. The doctor removes the prostate. Are you home free? No. In fact, 77% of the cancers come back. Only 23% are cancer-free, which means the odds are against you with surgery. So this man unfortunately had robotic surgery, and we know robotic surgery is no better than open surgery, and it looks like it's even worse with less good sexual function and less good urinary function. If he had come to us for a Gleason 10 cancer, and here's our data, it's page 11 of our booklet, our success rate is more than double. It's actually about 140% better than surgery. So where you get treatment makes a difference. Who does your treatment makes a difference. The data makes a difference. So don't get misled. Just because the cancer's in the prostate and they remove the prostate, you're not home free. This man should have known that he had a 77% chance the surgery wouldn't work. And I bet if he knew that, he wouldn't have had the surgery. But who told him? Who gives out the data for prostate cancer other than us? Well, we give the booklet. You can call us at our number 212-CHOICES, which is 212-246-4237. Call us during the